Right. Thank you so much. So good afternoon, everyone. Sorry for the technical delay. First, would like to thank A.Pec and Marcus for the opportunity to present our work. So this is, again, another point-of-care test for preeclampsia. So on behalf of our team, I will be presenting the primary results for our study, comparing the glycosylated fibronectin point-of-care test with the slft PlGF ratio for assessment of preeclampsia. And Abby, if I can have the next slide, please. Thank you. So this study is funded by NIHR UK, and all of the collaborators and authors declared no conflict of interest. So our aim from this study was to test the hypothesis of non-inferiority of glycosylated fibronectin to the slft PlGF ratio used for preeclampsia prediction. And in order to do this, we designed this study. Next slide, please. We designed this study as a prospective multi-center study occurring in 5 London hospitals, where women presenting to hospital with suspected preeclampsia between 24 and 36 plus 6 weeks were invited to participate. And after consenting, women were offered paired testing with both point-of-care glycosylated fibronectin and slft PlGF. And they were then followed throughout the pregnancy for the occurrence of the primary outcome, which was delivery for preeclampsia within 28 days of testing. We then compared the sensitivity of both tests using a predefined non-inferiority margin of 5%. Next slide, please. All right, so just a brief explanation of how we performed our test. So the slft PlGF was performed following the standard NHS procedure. So lab analysis, we had a centralized lab for all of our 5 sites. And for the glycosylated fibronectin, it was a point-of-care test. So we used a finger prick test with literally blood drop and then bedside analysis where results were available in 10 minutes. However, both patients and the clinician were blinded for the results of glyphin, but the slft PlGF ratio was available for clinical decision-making. So today I'm only presenting the results from our interim analysis. So this is the very first 150 delivered participants. So out of 150, 40 developed preeclampsia with a prevalence of 27%, and 32 had the primary outcome, which was delivery for preeclampsia within 4 weeks. Our median gestational age at recruitment was 32 weeks, and at delivery was 37 weeks, making the test to delivery interval median of 26, with interquartile range between 12 and 50 days. So first we started by comparing both biomarker levels between those with and without the outcomes. And you can see on the graphs here, so to the left is the glyphin and to the right is slft PlGF ratio across the gestational age. The red dots present those with a primary outcome, and the blue circles are those without the primary outcome. Further on, to test for non-inferiority, we've then calculated the sensitivity at certain predefined cutoffs for both biomarker. So next slide, please. Thank you. So we used 2 cutoffs for each marker, and as you can see here, these are the sensitivities and corresponding specificities. And using the higher cutoff revealed the sensitivity of 47% and 44%, while the lower cutoff had a sensitivity of 66% and 72% for slft against the glyphin. So further on to then compare the sensitivities to test for the inferiorities, and comparing the sensitivity at both points, the difference was ranging between -3 and 6, both of which are above our cutoff of non-inferiority. But as you can see from the graph here, that the confidence interval was still too wide, and it did cross the 5% non-inferiority margin, making our results so far inconclusive for non-inferiority. Next slide, please. So our conclusion at that point was that we need more data to assess for non-inferiority. So luckily, the good news is we now completed our recruitment. So we had a total of 400 participants. All of them have delivered, and we now have the full data. We are about to do the analysis now, and you hopefully will hear from us soon with the final results from our study. Next slide, please. Okay, so as a final note, I'd just like to thank my supervisors and all of the collaborators working on this project, and thank again APEC and Katie's team, our PBI supporters for the project, and thank you so much.
Thank you very much. That's really helpful, and it's great to hear of a new marker being used. I don't understand this marker particularly well. Can you explain it to me and maybe others? What is this marker actually testing for?
Okay, so it is a glycosylated fibronectin. So the initial studies for the glycosylated fibronectin, it was actually emerged as a marker for gestational diabetes, but then there was a correlation and like an incidental finding in the studies that it did correlate to the occurrence of preeclampsia. So the exact mechanism is unknown, but the hypothesis is as the PlGF and as the slft, it's one of the vascular markers and one of the markers of cell destruction or inflammation that happens as part of the preeclampsia syndrome. So in previous studies that has been done on this marker in different countries, namely in India and in Denmark, they have shown like a good sensitivity for the test for the prediction of preeclampsia within 1 week and within 28 days. But all of these studies were done retrospectively and mainly on serum. So this study is the first one to be performed in a prospective manner and in UK setting, and using the test as an actual in real life situation, as it would be used like as a point of care test using actual blood. So we are using the comparison against the slft PlGF ratio as the gold standard for prediction of preeclampsia recommended by NICE.